All right, so we are live. And so I'm watching both on Facebook Live and on Zoom. So I'll be my eyes will be going back and forth. So don't get dizzy, don't mind me, but I'm trying to make it so that way I can see your questions and comments that you may have. But your notifications should be going off because we are live, and looks like our sound is good. We're ready to go. We have a great show for you today, post Halloween and the first day of November. And I was just talking to my special guest today how we're so cold down here in Georgia. And I gave her a quick chuckle because we're in the 60s now. And in Georgia, that feels like it's got to be at least 30 below. We don't know how to handle ourselves. It's been 90 degrees plus for months straight. But it's 7 o'clock on the dot. I am Dr. Janelle OD, your eye care expert. I'm the CEO and founder of Brain Eyes Vision Center and Premier Eye Spa. And we're here today with you with Eye Spa Talk. We're relaunching today, and this is our 14th episode. I'm so excited. Eye Spa Talk, what we do, we inspire and empower women to be educated, healthy, and sassy. First, starting with your skin and your eyes. Sometimes your eyes and your skin can say more about you before you even open your mouth. So we want to make sure that all is well. Today, we have Linda Axelrod with us today, and we're going to be talking to her about a product that I love. No disclosures. I don't have any stock or anything in this product. I just believe in the product. I've been using it in my practice now for at least several years now. And we're going to talk a little bit more about why this is something you should have in your practice to offer to your patients, and why patients, specifically women, my eye squad, my girls that follow me on here, you should be asking your doctors about this product. A little bit about Linda. She leads Natural Ophthalmics with responsibilities for supply chain, quality assurance, and customer service. Linda consults with optometrists, doctors, and veterinarians all across the country, educating the patients and the doctors on a wide range of homeopathic eye drops and products and nutraceuticals. Currently, her products are offered in the US through a doctor's and a veterinarian's office. So hear that. So doctors listening, I have a lot of optometrists that follow me on here. This is something you definitely want to have in your practice to make you unique. And patients, this is where you can get it from for your doctors. But currently she's on the way and working towards expanding her products and availability of her products and brand to international markets. So we're going to get started today. Welcome, Linda. How are you today?
I'm great. Thank you. Lovely to be here.
Thanks for being here. So give us an idea of what the weather is like where you are.
Well, I'm in the mountains of Colorado. We're at 9,200 feet. We've had a couple of big snowstorms, which was good. It put out the wildfires. But this afternoon it was 60 degrees, which for us is tropical. And I was and I was sitting on my deck reading a lovely book in shirt sleeves while you were freezing at 60.
Freezing to death. Yes, I told Linda I'm a little bit embarrassed because I'm originally from Michigan. So 60s used to be tropical for me as well. And now I'm a true southerner going on 14 years here. 60 degrees feels like I'm in the dead of winter. So keep your fingers crossed. We're pulling out all our knee boots and everything. So we're going to jump right in because I have a lot of questions today for Linda so that we all can get a good idea about these products. But before we do that, just a little bit of housekeeping rules. If you have some questions, go ahead and put in the comments. I'm going to try to do a better job today about monitor the comments. Go ahead and do a watch party. As always, we're going to be giving you some great information. You don't want your family members and friends to miss out on this. And then remember, sharing is caring. So first off, what was the inspiration behind the company Natural Ophthalmics? And tell us about how you've worked your way up through the company.
Well, the company was started about 20 years ago by a gentleman named Brian Banks. He was the first U.S. representative for Similasan, which was a Swiss company that came into the United States and was available through doctors' offices the same way our products are currently available. Similasan decided to go OTC, and being available that way, the doctors felt, wow, where are our special drops? So Brian, with a team of formulators, NDs and homeopathics and ODs, was able to make a slightly better product than Similasan was offering, and he launched about 20 years ago. I joined just over 15 years ago as a Gal Friday, and now I'm president. It was a sad way of getting here. Our president and owner and founder, Brian Banks, unfortunately passed away almost 3 years ago, and went to me. And I'm very proud to be where I am.
Well, that's luckily you were there and ready to take over the reins of the company, with the sudden passing of the original president of the company. And before we dive in a little bit more about the products, one of my questions, we always have women on here who we like to hear your stories and just get a little bit of information on what it's like to lead or be a president of a company as a female. Is there any difference, or have you had any obstacles or any challenges so far in this transition into this part of the company?
I've been thinking about this question. I've never been a male president, so I don't really know how to compare. I'm me. As I say, I've worked my way up through the company. I'm doing 20 to 25 conferences a year. So I know a lot of people. And one of the great things is I have these grumbly old docs who come in from here and there, and everybody hugs me. And I'm friendly with everybody, and I know the other vendors, and I've worked up a catalog of people I can consult with and ask, and um, to be happy about all of our growth. And I don't think I'm having any problems being a female president. What I am doing, I hope, is encouraging other women to know that you can get here too. You start as a gal Friday and you work your way up, and you don't want to have a death in your office, but you can progress. And every receptionist that I speak with making orders, she knows that I'm the president, and that's a good thing.
That's important. You said that you are you, and I think that's important in any aspect, whether you are in an entry level position as a female in the company or male in the company. Be true to yourself, and I always believe that a genuine personality, a genuine person who cares, is gonna succeed, and that's gonna manifest in all that you do. And that is how it's gonna allow you to be in positions where things, like you say, you don't want a death in the company, but that means a lot with when this happened, that you were able to take over and you had the knowledge base and the support of the rest of the team to be able to do that. So that's commendable. So awesome. And so now we're going to get into these great products that she has to offer through her company. I want to talk about two main ones that I usually offer in my office. And there's a number of reasons why I brought them in, but you have an array of products, and I have the links to the websites where patients and doctors can peruse of different products that are available. But we're going to talk about your dry eye, your women's tear simulation. Yep, she has some. There we go. Perfect. And the allergy drops. What makes those unique? Yes.
Well, let's start with the fact that they're non-preserved. There is too many chemicals out there. Our eyes are so important. And if you can keep away from any preservatives, that's certainly a wonderful advantage. Our eye drops also start working in the very first drop. There's no buildup as there is with so many other products, Xiidra, Restasis, etc. They're very expensive. They take 3 to 4 to 6 weeks to start working. And when you stop, there's often a rebound effect. That is not the fact with our natural ophthalmics eye drops.
And no preservatives is important from the doctor's perspective of it. I specialize in ocular surface disease. So if anytime that you have a compromised surface, you don't want to add any additives to that surface that can possibly cause some additional irritations or allergic reactions and things like that. So it's important to have preservative-free options that are available. And when things are preservative-free, it also benefits some other ends. Let's talk about a little bit with contact lenses. Have these drops, can they be used with that? And I had a patient contact me before they saw the ad, and they want to know, are these drops safe for children?
Well, let's start with the contact lenses. Yes, they are safe with contact lenses in place, all contact lenses, hard, soft, sclerals, it doesn't matter. They're all safe. Yes, they're safe for children. And the fact that they don't sting makes them especially good for pediatric practices and for working with animals. Dogs get dry eye, cats get allergies. So the animals come and they go, give me more, because they know that it doesn't sting when it's applied. It feels good. And so it's a special advantage with kids. Also, it's fine for pregnant women.
Yeah, and that's what I'm gonna say. I do a lot. I like it because when you wear contact lenses, you don't have to take contact lenses out, put them in to be able to steal your drops. Stinging pediatrics, but even adults. I have some adults who are very apprehensive about putting drops or things in their eyes because they sting. So that's definitely an added benefit that they don't sting and make them safe for contact lens wearers and children. So, um, couple other questions that we have here, and I hear this a lot. The drops work, meaning they're homeopathic. So we want to talk a little bit about what does it mean to be homeopathic, and is there a difference between that and organic?
I'll come back to the difference between a homeopathic and organic in just a minute. Let me explain a basic um, way of understanding how homeopathy works. Most of us, especially now, we're all cooks. We're chopping onions, and what happens? Your eyes get red, they get irritated, they tear. That is an overreaction to a toxic element,
Mhm.
which in this case is allium. We have allium, a tiny little bit of allium in our allergy drop. So when you have allergies, you're tearing, you're red, you're itchy, you're nasty. But and so that's an overreaction when you're cutting the onion. But in the allergy drop, it is an infinitesimal amount. And what it does is it kicks the body into fighting that allergy instead of overreacting to the allergy. So if you come in from gardening or mowing the lawn or whatever, and there's a new allergen blowing through, in Georgia, you have a lot of allergies,
Yes.
a lot of allergens. Just grab the allergy drop, put in a drop. You can even put in 2 or 3 drops, and it acts as an eye wash. And then what you're going to do is use it periodically, every 2 hours, every 3 hours, until that allergy goes away or your eye is better able to handle it. What we're trying to do is get the body to take care of itself rather than masking the problem. There are no antihistamines in it.
Mhm.
Antihistamines mask the problem. Will then give you dry eye. Well, that's not going to help.
Yes, exactly. If I'm treating dry eye, then I don't want to exacerbate the problem that I'm trying to make better, right?
Exactly. And then you ask the difference between homeopathics and natural
Or
or
natural,
organic.
organic. I hear that a lot. Some people get those things confused.
Well, homeopathy, one of the ingredients in the allergy drop is sepia. Sepia is harvested from squid ink.
Mm.
So is it natural? Yes. Are our products grown organically? Yes, but it's not vegetarian.
Hmm.
Um, Organic. It's
Yeah, I guess
organic.
vegetarian is more like plant-based. So we have these words that are out all the time: vegetarian, plant-based, and now you have homeopathic. And I see there's some rooms for patients to get things confused. And so I always like to have some of that air cleared up a little bit. But I want to back up just a little bit when you're talking about how things work with a homeopathic option, meaning you're trying to create homeostasis. That's the goal. Keep the body balanced, allow the body to project its own self defenses. So, is a homeopathic similar to almost kind of like a vaccine? A lot of times with a vaccine, you're introduced to the condition so that your body can present a defense against it. So people say, well, I got a flu vaccine and I got the flu. Well, it's almost kind of introducing what you're going to be exposed to your body so that way you can have a response to it. So it's almost like you going to battle a little bit earlier, you're practicing. So when the battle comes, you're ready. So is that kind of along the same lines, or is that a stretch?
You got it. It's kind of like on the same line, except that the homeopathics are in a micro dilution. They're not
Okay.
synthetic, as we'll often find with vaccines.
Okay. Micro dilution. And then for our listeners that are listening, what does micro dilution mean?
An infinitesimal amount.
Okay.
Infinitesimal. You would need extreme equipment to find it within the solution. And people say, well, then how's it going to work for me? That's part of the mystery of homeopathy. But you
Mm-hmm.
got to remember that homeopathy has been out there for 400, 300, 200 years. They've
Mm-hmm.
been working on it. And what you do, it's experimentation. if you add a little bit of this, are you going to get the right result? And it's like any other production of a medication. It's trial and error until you find what works the best.
And so, how does homeopathy align with, I guess, say modern medicine? And I'll kind of back up a little bit. I have patients, and nowadays, patients are very in tune to finding more of a natural way to address problems. They're not against modern medicine, but if there's a more of a natural way to address a certain issue, let's try that route. So I have some patients who I'll come in and I'm checking them for, let's say, diabetic retinopathy, hypertensive retinopathy, and they're confiding to me that they stopped their medicines. And so we have a conversation. They're saying they'll try a natural route, a homeopathic route. And I'm saying, well, wait a minute, have you had conversations with your doctor first? And they're like, well, I don't know if my doctor would be on board. I don't know if they will believe in this. And I want to try this first and see if I can get my numbers down to basically convince them so I can get off the medicine. And I didn't want to be that type of doctor that was so closed-minded that I didn't know that there were other options out there for patients that are going to try. My thing is like, I want to be that guiding light with my patients. So how do you deal with, eye care professionals or anyone else that may say, homeopathic, that's rubbish. That doesn't work. They have to have these prescribed medications. How do you address those type of that negativity?
Well, there are certain conditions you and I both know that need to be treated with allopathics. There isn't a good homeopathic treatment at this point for glaucoma.
Hmm.
A patient has got to stay on what the optometrist or ophthalmologist has prescribed. Same thing with high blood pressure or high cholesterol. Yes, you can do some work with changing your diet and getting rid of the stress, but in a perfect world, we could do that.
I
This is
know.
a perfect world, and sometimes we need to go with these allopathics. You can add homeopathics without any problem. There are no drug interactions, and there's no possibility of overdosing. So it's certainly worth trying, depending upon your situation. Again, I use glaucoma as an example. It's a very serious disease, and you can't stop the allopathics. You can help them.
Exactly. And that's why I always say you need to, a lot of times you can do these things in tandem. It could be an adjunct therapy, but you definitely don't want to stop these things without having a conversation with your eye care provider, your primary care doctor, whoever is treating you. But at the same time, I definitely think it's important for doctors to know what options are out there that these patients may be doing on their own, unbeknownst to that doctor as an adjunct therapy. So I think that's a good important point that this doesn't necessarily replace anything. A lot of times it's a good adjunct therapy. The way I use them in my clinic is some patients who for ocular surface or dry eye disease are on the milder side. So we'll kind of start here if it's more episodic. And then we'll kind of introduce this as an option. And I tell you, my patients love it. There was a time where it wasn't available and they just kept coming in the office. And I'm like, look, when it's back, I'll tell you guys. So I'm so excited now that it's back. It has a special cap on it so that it helps to reduce your chances of contamination when you're having something that's preservative free, and there's plenty of preservative free drops and things over the counter or even prescribed, but you have to be very careful to make sure that you don't contaminate because we don't have all that added toxins in there to prevent contamination. So you have to be very cautious when you're using the product. So that brings me to how are your products manufactured? What is the shelf life on a preservative free drop? Is there anything different that our patient will need to do once they open those drops to make sure that they're being careful?
We're trying to stay ahead of the FDA. We previously, we had a multi-dose, non-preserved bottle.
Mm-hmm.
Now the FDA soon is going to insist that we have a special cap on the bottle. This particular cap is called the Aptar. It's the manufacturer. It is yeah, I'll open it for you.
Mm-hmm.
It looks like that.
Yes. Okay.
With this particular bottle, what you have to do is you have to prime it. When you turn it upside down, you put one drop onto your finger, and this is partially priming the bottle, but also it's priming. See, I got two drops. I
Mm-hmm.
squeezed two. It's priming the patient to know how hard to squeeze or not to squeeze. But if you get two drops in your eye, it's really not going to hurt. That excess
Mm-hmm.
is just going to run down your cheek.
Okay.
Uh, so, yeah, with this new Aptar cap, you don't have to throw it out after 30 days use. You can use it until it's finished because it's impossible for it to become contaminated. What happens is there's a mechanism in here. It's an airlock. Once a drop comes out, it locks itself, it closes itself so that you cannot contaminate it. Even if you dropped it in a mud puddle or put it in your pocket, it's a safe bottle. So
Oh, that's
that's,
amazing. That's
yeah, it had
amazing.
added expense, but it was a necessary expense to be able to get our products out to the people who need it.
And so let's also talk about, we talked a good bit about some of the ingredients and things in the allergy drop. Let's talk about the women's tear stimulation drop. Is that the one that's still available now? I know that's one of my favorites. Patients really love that one. Is there a difference between men and women tears? And what's the big deal with that?
Well, we have two drops for tear stimulation. One is the women's tear stimulation, the other is Forte. The Forte used to be called men's tear stimulation, but we found that many doctors were prescribing the men's also for the women. It seems to be a little bit stronger for patients with Sjogren's,
Mhm.
and it helps a little bit more with the meibomian gland issue. But right now, we only have the women's available, and it's very good for all of those issues. We will have the Forte again in the spring of 2021.
Okay. And you talked about priming. I know when we first started using these drops a couple years ago, there was the way you would prescribe it's like a loading dose. Is that still something that we need to be having those conversations with our patients? And if so, can you talk about that a little bit?
Absolutely. A loading dose or front loading means when you get the product, use it 4, 5, 6, even 7 times a day for the first day or two. And what that does is it kicks your body into saying, "Ooh, this is good. I like this. I'm going to react positively." It's in a way it like sort of like Pavlov's dogs when you train them to ring a bell and they'll get fed and they start salivating ahead of time. Your body gets ready for this and it likes it and it responds positively.
Oh, that was
And
a
then
good
you
analogy.
back off to an as needed level. Hopefully 2 to 3 times a day. I like to say certainly use it first thing in the morning and use it the last thing before you go to sleep. Carry it in your pocket during the day for when you need it. Don't wait until it feels like the whole beach is in your eye, sandy, miserable. It's like thirst. Don't wait until you're so thirsty until you open up that water bottle. Sip throughout the day. Treat your body nicely.
That's a good analogy. That's what I tell patients too. Don't wait till it's so dry and irritated that, you have to just keep putting things in. And I will say, patients who use this drop, they found that they can go, so when you get to the as needed, they would start getting most of the day. And as they got into using a drop more and more, that they would say, oh, you know what? I haven't put a drop in today and my eyes have felt pretty good. So that means the body is really responding positively to the drop and learning to maintain the comfort levels that the body wants. And our patients, like I said, truly love it, and it definitely helped if they wore contact lenses or if they have allergies, it wasn't exacerbating anything.
Correct. And the whole idea is to get the body to repair itself. And look, I'd love to get everybody off of the drops, solve your problem, and move on. Unfortunately, that's not how our eyes work and the meibomian glands are working, but it's not just a tear replacement, it is corrective.
Hmm. And that way, that's part of the reason why you find yourself being able to go longer days and sometimes multiple days in a row and not having to put a drop in. Um, and so, while we're talking about this, and I think you touched on this a little bit earlier, are there any contraindications to or side effects when you're working with these type of homeopathic drops at all?
No, 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 and no. No contraindications, no drug interactions. You don't get addicted to them. You can't overdose with them. No, 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 and no. It's very simple.
Good. So no, no, no. We keep that easy. No, nothing hard to remember there. And so basically, how do first of all, let's talk about how do doctors get this product to be able to offer in their offices?
give me a call, spend 5 minutes on the phone. I'll set you up an account and we'll send you sample and information packs. We'll send you an e-catalog so that you can read about all of the ingredients. Each ingredient is listed and it tells what it helps, inflammation, redness, uh, irritation, foreign body sensation. You don't have to be a homeopath to prescribe these. We help you to help your patients with a better product.
Product. Good, good, good. And then, and what do you want your or my listeners to know about Natural Ophthalmics, about the products, about the company? What should be our take home today?
Keep it simple. Find a drop that works for you. Use it. Put it away when you don't need it, and take it out again when that allergen comes back or when your contact lens is irritating you. Keep it simple.
Keep it simple. Yeah, and in the day and age that we're in now in 2020, we need a lot of simple. We need a lot of simple. Every day seems like it's just like, what's next? So definitely keep it simple. And so my last question, I think it just escaped me there. I had a question I was going to ask you that I was like, okay, I'm going to ask her this.
Okay.
That's my dementia brain is stuck in there for a minute. But yeah, we want to keep it simple. We don't want to make it difficult for you to have to know what drop to use, when to use it. Oh, and lastly, is this available over the counter, or do you have to consult with your primary care provider or your eye care provider for this drop?
It is not available over the counter. That was what happened with this previous product, Similasan. The doctors stopped being able to carry it exclusively. Your eyes are so important. Don't make a mistake and pull the wrong product that could injure you when you really need an examination to know exactly what's going on before you start using a product.
Okay. And now, do you have a way that the patient can do like a subscription service through the doctor, or the patient actually, once they start taking this drop, they just kind of come by as needed to get the drop and purchase it right from the provider?
They should continue to purchase it from the provider. There are programs for doctors' offices if they don't want to carry it in their offices, that they can send patients to certain places and where they will get it through mail order. And we were happy to help them set that up because not every doctor carries products. They have many reasons why they don't do that.
Oh, that's awesome.
The
Yeah. So
reasons why they
especially
do.
too nowadays when there, some patients who are more at risk, who are not really wanting to come out of the house as often, it definitely that'll be awesome to have. I would like to find out some information on that as well, to have an option for some of my patients. We tend to do a lot of things that are portal based, mail order, that it could be sent directly to the patient. So that's awesome. And then usually the same question I always get, is this covered by insurance? Patients, how do patients pay for this? That's a question we always get from patients.
Well, the price of the bottle is less than the copay is going to be for anything else. Um, and if you have an HSA, it'll pay for it. But you can't, Medicare is not going to pay for it. United Healthcare is not going to pay for it. But it is very, very reasonably priced. There's no reason why a patient can't afford it.
Yeah, and I agree. Patients that needed it, that was never a stumbling block for them at all. But I always like to ask that because that's a question we always get in healthcare. Who pays for it, or how do I pay for it? But yes, you made an important point that if it's through your doctor's office, a health spending account, FSA, and also any providers that may take care credit. Typically, if you are in the care credit office, anything that a patient is purchasing in your office, they can purchase, so they can add those into their glasses purchases to get those drops and things that we need, especially going into the winter months. We lose a lot of humidity in a lot of states. It's drier, and you don't want to wait till you have a huge flare up. And then that's when we have to, get a little intense with our treatment plan as we scale things back. So I just want to make sure that I got all my questions. I had questions I wanted to ask her, and I got them all. Yep. So we got them all in there. So I'm excited to have Linda here with us today. And I'm so excited about their repackaging, relaunch. And we're still waiting for our product to come in. I need to ask you too. I think I may have didn't update my address. We moved. And so, so I hope, I was like, I just thought about it today. I was like, I've been so, because I was going to show my samples, and I'm like, You know what? We moved in August, and I had a few people that I don't think I updated. Yes, and so those are the nifty little boxes. She showed us the bottles. Very easy to use. They have the airlock, so that way you don't have to worry about contamination, and you can use it until the bottle is done, and don't have to throw it away, which is amazing. So you definitely get your money's worth out of this drop. It's definitely attainable. I'm just going over some take homes. It's safe for contact lens wearers, safe for children. No contraindications, no side effects. It doesn't sing, so it's a good win. I love the dry eye drop. Like I said, it works really great in those early phases of MGD or dry eye disease. And a lot of times it makes a big difference in the overall comfort of our patients' eyes and their outcomes in those early phases. Linda, so let's give the listeners and the doctors, we have a lot of optometrists that follow us on here, the website where they can contact you or your phone number if they decide on Monday morning they want to give you a call to be able to have this product in their office.
Our phone number is 970-468-9020. You can go onto our website, both doctors and patients. You can go onto naturaleyedrops.com. That's drops plural.
Mhm.
And it will bring you to our website. And you can read all about the drops that we carry. And doctors, there is a form on that and through our website that you can get in touch with us or you can call us.
And let's see, I think we have one question here. I think we probably already know the answer to this, but I'll go ahead and ask, is there patients who, I have a lot of patients who go through like chemo and radiation, and they tend to have a lot of dry eye, discomfort of their eyes. We're learning now more about how those treatments affect the meibomian glands. Is this something that is safe for those patients to use to try to keep their eyes hydrated as they're going through this treatment for cancer?
Yes, undoubtedly. Unfortunately, I've had many girlfriends who've gone through cancer treatments, and every single one I send eye drops to, and they are so thankful. So we're also starting to spread this knowledge to oncologists so that they can keep their patients happy and comfortable through all the other stresses that chemo brings.
Definitely. And like I say, and usually as an eye care provider, your patients are opening up to you and telling you that they're going to start these processes. I've had a lot of patients that come in, and as a ocular surface disease specialist, we try to do as much as we can prior to treatment to try to salvage a lot of those glands that are part of keeping the eye hydrated. And yes, sending drops. And so definitely this is on my list to make sure we get out to those patients that who are starting those treatments. So that was a great question. I just wanted to make sure here we're just finished Breast Cancer Awareness Month that this is an option to keep patients comfortable during those trying times as well. Linda is awesome. She's always available and responsive quickly through email. I like to email people, and she probably knows I email if I have a question, if I want to order something, and they usually get things right out, get it right so that we're able to get it out to our patients. I thank you for spending time with us. You said you're on mountain time. So what time is it there?
Um, I haven't changed the clock here, so I'm lost. I know
Yeah, so
the sun has set.
the sun has set, yeah. And so my brother lives out west. And so sometimes he's 3 hours behind us and sometimes he's 2 hours behind us. And I think now
Oh,
maybe.
that's because he lives in funny Arizona.
Yes, that's where he lives. And I'm like, I don't know. I just know I'm near bedtime when you're calling me and I'm calling him. He was like, I'm still at work. And so I always get so confused with Arizona. Yes, they go between mountain and out west. So yeah, we're 7:32 here and the sun has set. And I appreciate you taking the time to talk with us today. I believe that we got some valuable information, a product that I guess I've been using since about at least 2017, 2018 in our office. Patients love it. You always want to have an option that is a natural based option for patients to try in early phases of disease conditions and as an adjunct therapy. Usually, when it's natural, it's not going to have any adverse effects and can do nothing really but to help. And then we also learn it's a great option to have for patients who are going to start chemotherapy and radiation. And so if you want to do something really nice, go ahead and get them a bottom that you give to them, or have them come on in so they can get those before they start those treatments and keep their eyes comfortable. Linda, thank you again. I appreciate your time and I want you to enjoy the rest of your Sunday evening and get those clocks changed back so you won't be so confused on Monday. Don't be like me. You have half of the clocks in the house changed, half of them not, and then you're rushing and then you get excited because you have 1 hour actually you're ahead. So
Well, thank you. It has been an absolute joy being with you and your viewers, and look forward to chatting with you again.
Alrighty, so my I Squad, you guys enjoy the rest of your Sunday evening. Like I said, get those clocks changed back and let's get ready for a new work week starting. And all us Georgians, let's get our sweaters out. It's time for us to get our knee boots and our sweaters. We're so excited. Yes, we love fall here. Because we've been burning for the last couple months. So we're excited now. But again, thank you, Lyndon. I want you to enjoy the rest of your evening. And you guys can catch me here next Sunday at the same time. We're going to have a special treat. So follow me so you can see who's going to be our guest next Sunday evening. All right. Enjoy the rest of your day. All right. So it's ended. All right. Bye.